So certain areas of your brain are very important, which will actually decide the function of your body, of hand movement or leg movement are decided by certain areas of brain. But sometimes what will happen is the tumors would be located. So this is the area of brain which decides your hand and leg movement. By chance, if a tumor is located here, when we are removing that kind of a tumor, there is a possibility that patient can actually develop some kind of a weakness in the postoperative period. So when we are operating a patient, we will not know what is actually function of that part of the brain. So this technology is called as neuro monitoring technology. This is connected to the patient like this. From individual muscles, we'll get signals. Okay. So during the surgery, real time will come to know if that part of brain is having function. If it is having a function, what function it is doing is what we'll get to know by this technology. This is called Cadwell IOMAX, and we have that in Aston Whitefield.
So while you're doing the surgery, you're actually checking what will be the impact of that surgery.
We'll be checking like that when we are operating.
Okay.
On the brain, if we get a signal, we'll get to know which part that particular brain is controlling, and we should try to avoid that. That's correct.
So if it is a very critical function,
Yes.
then maybe better not to do
There are only two critical functions.
not
for
to
us.
remove the tumor because
Yeah. So before operating, we have to stimulate like that and check. So two critical functions are there. One is movement of the hand and leg. Second is speech. Those two things we should try avoiding any damage happening to those areas basically. So that is what we would be doing. So we identify like this and we'll try to avoid those areas. And so like that, so many gadgets are there. So these are so many gadgets available here. So these are the instruments we use, and neurosurgeon will be, by using all these instruments, they will be stimulating. So every surgery will have different kind of gadgets that we use to identify the functional areas of the brain. Okay, no? Yeah, we'll go to the next station.